Good morning to you all. It is Dr. Fern here, and you medicine women are here if you want a life that you absolutely love. So yesterday I had a really interesting day with, it was jam-packed. It was the last day that I could give crowns to my labs before the labs didn't accept crowns anymore, or onlays, it's what I do. And it was crazy because every single patient who hadn't booked for the last 6 months to 12 months decided that they needed to get it done right now before the end of the year. But anyhow, Rosie, my nurse, and I'm sure she won't mind me mentioning her name, in the morning she was just dropping everything, and she was fumbling and mixing up things and not being there when I needed her to be there for the patients. And for some reason I was super sensitive, and I actually was getting quite a sore neck and sore headaches, and I could feel the tension, and I could feel myself starting to just anticipate and look for the next time that she didn't do something the next time. And of course she didn't. She kept dropping more and more things. And there's two ways to approach this. It could either escalate and the patient could then start to feel it, and I could get worse and I could feel worse in my body. Or what I chose to do was, after the patient was well out of there, I actually came up to Rosie and I sought first to understand what was going on. And I said, hey, what's going on? What's going on? Do you want to come in and talk about it? And I ceased fire. I changed the state. I got another nurse to finish up packing for her, and I popped her into my other room away from everything. And I just sat with her and I said, hey, what's going on? This is not you, Rosie. Do you want to tell me what's going on? And she didn't want to initially because she was quite embarrassed. But then, of course, then she got upset, and I held that space for her so she could get upset, not trying to stop her tears or not trying to console her in any way, just allowing her to let her emotions out like a toddler would. And then I asked first what was going on, and I knew she was better than that. And she explained that she felt really frantic, she was feeling, and I got her into her body. And I got her to breathe and tell me what was going on in her body when she felt like that. Because it wasn't that she didn't know how to mix an alginate impression. She knew how to, but she just wasn't doing it properly for like the 10th time. It wasn't that she didn't know. She had all the skill sets, and I believe that she had all the skill sets. It was just that her mind was getting in the way, and she was starting to get more and more frantic. And the more frantic and anxious she got, the more she started to doubt herself. And of course, the more she doubted herself, the more she fumbled. Okay, it's basically an omen in your head. You think that something's going to happen, you think you're not going to be good enough, and that's what's going to happen. And that's your mind will create your reality. And that was what was happening with Rosie. So I got her to cease fire, I got her to stop, I got her to breathe in her body, release, release, release. And then I allowed her, and I held space for her so she could imagine what the afternoon would look like, how she could be her best possible self of herself. And she could see that, visualize it, feel it in her body, let everything go in the morning and let it go. And then it was incredible. The afternoon, she was a totally different person. She was like, her mind, the skill sets she was there for me every step of the way, and we had an incredible day, and I thanked her. But I just want to highlight this because there are times when maybe your nurse is not doing her job and it's irritating you and it's getting you more frustrated. And rather than berate her or kick her under the chair or get more and more literally shitty with her, maybe it's time to take her into another room, seek first to understand, get her in her body, get her breathing, and get her actually visualizing the best version of herself, and that she can actually do it. Okay, and that is your job as a leader, to bring out the best in everyone around you, and that starts with you first. So if you're doing that to yourself and you're getting in your head and you're getting all these crazy thoughts happening, it's time for you to cease fire, get out of that state, and recreate the story of the next few moments, because every single second is a new second that you can recreate for yourself. That is the blessing in our life. You can forget the past. Okay, that is my daily dose of Dr. Fern. If you like what you hear, please share this with your friends. Otherwise, remember to laugh out loud. It is the second best thing you can do with your mouth.